The one thing that I've noticed with growing up with a mental illness is that it is not taken as seriously as any other physical illness. Mental health is very much neglected. It is not taught enough in schools, and there are not enough doctors studying the field because either they feel as if it is not as important as other illnesses. Taking care of one's mental health is also just as important as taking care of your physical health. It affects more people in the world than you think. At some time in their lives, around 46% of people had at least one psychiatric disorder, according to the American Psychiatric Association. The rate was highest for anxiety disorders, including panic disorder, generalized anxiety disorder, social anxiety, phobias, and post-traumatic stress disorders, also known as PTSD. More and more people with the mental illness are seeking treatment today than in the early 1900s, but treatment is still delayed and inadequate. Mental illness in the 21st century has dramatically increased from ages 13 to 22 years old. Even though it doesn't have a for sure cause yet, it still needs to be taken seriously treatment-wise. Lower but still dramatically high disorders would include control disorders, including ADHD, also known as attention deficit hyperactivity disorder, conduct disorder, and oppositional disorder. 21% of people had a mood disorder, and 15% of people had been dependent on alcohol or other drugs. Mental health causes all different kinds of alterations to the brain, including mood, thinking, and behavior. There are also many different kinds of classified mental health disorders. The most common disorders are anxiety disorders, mood disorders, psychotic disorders, and eating disorders. Anxiety disorders affect the response to certain objects or situations with fear, panic, or rapid heartbeat. Mood disorders consist of persistent feelings of sadness, periods of feeling overly happy to extreme sadness. Psychotic disorders are the distortion of awareness and thinking. Last but not least, eating disorders cause extreme emotions over weight and food. To go more into depth, there are 6 types of anxiety disorders. I have been diagnosed with 2. By the age of 12, I was diagnosed with social phobia and generalized anxiety disorder. A social phobia is the fear of social interaction causing irrational anxiety. This certain type of anxiety disorder caused me to avoid all social conflicts. To explain this better, people with social phobia tend to overthink about certain situations while expecting the worst to happen. I did not attend my senior prom because of this, and I cannot remember the reason why that I did not want to go, but I deeply do regret it. Generalized anxiety disorder causes ongoing anxiety that interferes with daily activities. Again, with avoiding certain situations, getting up and going to school was my biggest daily battle. This is the most common disorder in teens from age 11 to 18. Mood disorders include bipolar disorder and major depressive disorder. Bipolar is a disorder associated with episodes of mood swings ranging from depressive lows to manic highs. Major depressive disorders is the constant feeling of sadness. Psychotic disorders are as severe as mental disorders can get. These disorders include a disconnection from reality. In better words, not being able to tell the difference between what is real and what isn't. Some of the symptoms include delusion, hallucination, agitation, and agitation. Lastly, eating disorders. I think these are more known to society because they are not as blind as mental health, other mental illnesses. Even though the illness is still psychological, this disorder is the obsession of weight and or food. Some types of eating disorders include binge eating, anorexia, and bulimia. A lot can cause the onset of mental illness, including genetics, infections, brain defects, or injury, prenatal damage, and substance abuse. The most common cause of trauma suffered as a child such as emotional, physical, or sexual abuse. Also, a loss of a loved one at an early age can also be the cause. The primary treatment for mental illness is usually medications. Medications have been developed to relieve different symptoms so that it may be taken for something specific or more than one combination to deal with different symptoms. Medications can be categorized by their functions. Antipsychotics for symptoms of psychosis, antidepressants for symptoms of depressions, mood stabilizers for extreme mood changes, and benzodiazepines for the relief of anxiety. The second most common treatment for mental illness is therapy. Some include cognitive behavior therapy and psychotherapy. Although there are a lot of treatments, they are not always the first choice. Many people are ashamed or embarrassed of seeking treatment. It is also portrayed as weakness rather than a cry for help. My hope for the future is that more people realize the importance of mental health and take it as seriously as any other physical illness. As someone that struggles every day with a mental illness and experiencing the ugly side of society when it comes to acceptance of mental health, I want to make it more aware to the public about the precautions to take and more knowledge about it.